If your feet feel numb tonight or burn when you lie down, this could be your body trying to warn you before something serious happens. And what I'm about to show you, most people only discover after it's too late. My name is Dr. Michael Kent, and after 30 years working with older adults, I've learned one thing that I need you to hear very clearly. The body does not fail suddenly. It whispers first, then it warns. And if ignored, it starts taking things away. Your balance, your mobility, your independence. Now, here's what most people don't realize. The very first place these warnings show up is not in your blood tests. It's in your feet. Let me ask you something. Have you ever felt tingling, burning, or discomfort in your feet, especially at night? If you have, stay with me, because a 67-year-old patient told me the exact same thing. Just a little tingling. Nothing serious until we looked closer. 4 warning signs, undiagnosed diabetes for over 2 years. And here's the dangerous part. There's no alarm, no dramatic pain, no moment that forces you to act. Just quiet signals, easy to ignore. But today, that changes. Because in the next few minutes, I'm going to show you 9 warning signs your feet may be giving you right now. And number 3 is the one that sends most people to the hospital. So don't skip ahead. Start with this one. The first sign is the one almost everyone ignores. That light tingling, like ants crawling under your feet. Now I know what you're thinking. It's just from sitting too long. But here's what most people don't realize. When this starts happening more often, without a clear reason, your nerves are already under stress. High blood sugar slowly damages the protective layer around your nerves. Think of them like electrical wires. When the insulation breaks down, signals become distorted. That distortion is what you feel. Not pain yet, just a warning. And this is where everything begins. The next sign is the one that steals your sleep. It is burning feet at night. Not during the day, not when you're busy, but when you finally lie down. Now here's what most people don't realize. This heat isn't external. It's coming from damaged nerves, like a fire alarm going off. But look closely, there is actually no fire here. And night after night, your brain keeps reacting. This is one of the earliest warning signs, and it often appears years before diagnosis. Now this next sign is where things become serious. A small wound. That doesn't heal. A blister, a cut. It could be something minor, but it stays. It refuses to go away. Here is exactly why that happens. High blood sugar damages blood vessels, and without blood flow, healing stops. This is where infections begin. And in many cases, this is how amputations start. Let's pause for a moment. How many of these have you noticed? I want you to be completely honest. The next sign is visible, but often completely overlooked. It shows in the subtle changes of your skin color. Sometimes it looks darker or significantly more pigmented than usual. Sometimes it looks much darker or significantly more pigmented than usual. Other times it might appear red or even slightly blue, a condition we call cyanosis. This is more than just a surface issue. This is your circulation slowing down. This is more than just a surface issue. This is your circulation slowing down. Your body is struggling to deliver the vital oxygen your cells need, and your skin is simply the messenger showing you what's happening deep inside. Your skin shows the reality of your internal environment. Without proper oxygen delivery, the tissue begins to change its appearance. It is a slow process, often starting at the extremities. Keep a close watch on these subtle shifts in hue. Now, this next sign might seem harmless at first. Cracked heels. Many people ignore them as a cosmetic problem. But when they become severe and painful, it's a warning. But when they become severe, it means something deeper is wrong. Your body is losing its fundamental moisture control. This isn't happening just from the outside environment or dry weather. Not from the outside. It's failing from the inside. It is failing from the inside, often linked to metabolic issues. and these deep cracks literally open the door to dangerous infection. This opens the door to infection that can travel through your system. We must look deeper than the surface to find the root cause. Don't wait for the problem to worsen before seeking advice. Your heels and your skin are vital indicators of your internal health. Listen to what your body is trying to tell you. See you in the next part. Part 6. Now let's discuss the warning signs of swelling. Swelling in your feet and ankles, visible marks left from your socks. This is known as fluid retention. Your kidneys may be under stress, and your body is holding on to fluid. If any of this feels familiar to you, please don't panic. The good news is that you're catching it early. Part 7. Let's talk about sharp pain. Sharp, electric pain. This sharp pain is both sudden and unpredictable. This is usually nerve misfiring. This is usually not arthritis, and it is certainly not an injury, but internal signals gone wrong. Cold feet, even in warm conditions. This is more than a minor chill. If your feet feel like ice while the rest of your body is comfortable, pay attention. This is circulation failure. It means blood isn't reaching your extremities. Your arteries may be struggling to deliver the warmth and oxygen your feet require. And as a result, your body is losing warmth in the areas that need it most. When the flow slows down, the heat vanishes. This is your body's distress signal. It's a sign that your heart is working harder than it should to reach those far points. Since your feet are the furthest from your heart, they are the first to feel the impact. Ignoring this can lead to deeper metabolic issues and systemic inflammation. Early detection is key to preventing long-term damage to your vascular health. Treat your cold feet as a vital clue, not just an inconvenience of the weather. Monitoring the temperature of your extremities can save you from future complications. Listen to what your body is trying to tell you about your circulation. Now let's look at Part 9. Hair loss on your legs or feet. The sign is often subtle, but it is incredibly important for your diagnosis. You see, hair needs consistent blood flow to grow and maintain itself. When circulation drops in the lower limbs, the hair follicles are the first to starve. And when the nutrients stop arriving, the hair growth simply stops. This is a classic marker of peripheral artery disease, also known as PAD. Your body is intelligent. It prioritizes vital organs when blood flow is restricted. Non-essential functions, like hair growth on your feet, are shifted to the bottom of the list. I want you to check your legs tonight for these smooth, hairless patches. It's a visible marker of what's happening internally with your vascular system. Don't just dismiss it as a natural part of aging. It's a warning sign. Recognizing these changes early allows us to take action and restore your flow. Let me leave you with this final thought. These signs don't appear overnight. They build slowly, quietly, and that's exactly why they are so often ignored until it's too late. But your body is not failing you. It's trying to protect you by giving you warnings. Tonight, take just 30 seconds. Sit down and really look at your feet. Check the temperature, check the hair, because early awareness changes everything. It's not too late to take control of your health.